Okay, social butterflies and social rattlesnakes. My name's Danny. This is My Own Worst Enemy, mental health podcast. As you can see, if you're watching this on YouTube anyway, got all the Christmas decorations up and stuff, trying to get in the Christmas spirit. Have a look at this t-shirt. See that? Eat, sleep, turkey, repeat, which makes absolutely no sense whatsoever because eat, sleep, turkey. Well, no, because turkey is surely part of the eat bit, or I've already eaten, so I'm not going to want some turkey, am I? And it's not eat, sleep, turkey, repeat because you only eat turkey on Christmas Day. So it's just eat, sleep, turkey, or just turkey, sleep. Rubbish. About, what was it, 15 quid this t-shirt, something? Rip off. Anyway, God, that's not the best start to a Christmas episode, is it? Right. Let's try and in fact, I'm just gonna carry on moaning anyway now. So let's while we're on it, let's keep moaning. So this month has been an absolute shit show on this podcast, right? Because what I tend to do is I try and book 5 guests per month. So, I do 1 episode a week, and then I've got 1 in the bank for in case anybody drops out. This month, 4 people have cancelled on me last minute as well. And which, I know people have all got the reasons and stuff like that. Some of them were legit. Some of them sounded a bit fishy. But with this last one, so with it being Christmas, I wanted to do a topic, cover the topic of loneliness. And so after all the cancellations with the guest I had planned, I kept sending emails saying, look, are we sure we're definitely on? Everything's going to be fine. Everything's going to be fine. It must have reassured me like 4 times. You're like, yeah, of course, we're fine. It's on. Stop worrying. Like to the point where I felt like I was annoying them. Keep asking. So I'm thinking, okay, great. So I at least got this 1 episode. And then on the day, what did they do? Cancel on me right at the last minute with less than an hour to go, which is what everybody else has done. So starting to wonder if I've got some sort of reputation going on that I don't know about, going through the psychological community where everyone keeps cancelling on me, but whatever, is what it is. So yeah, I've got like a couple of days to go until the episode's due out, because I wanted to put one out before Christmas Day. And I wanted to cover this topic of loneliness. I think it's quite, it's opposite, it's Christmas, and I've been through it myself. I spent a Christmas by myself and it was horrendous. And then a couple of years ago now, when I was working, hosting the mental health support group that I had in Manchester, one of the Christmas a couple of years ago, I decided to host an event on Christmas Day for people in Manchester that didn't have anywhere to go. And God, I was shocked by the amount of people that actually responded to it. Not so many actually turned up on the day, but it was something like 40, 50 people were saying that they were going to spend Christmas alone and that they might try and make it to this event we did. So it's quite a big thing. So I really wanted to, thought it was a good topic for Christmas, bit maudlin, but like I say, appropriate. So anyway, this interview's been cancelled. So I'm thinking, right, what can I do? So I think I've come up with a brilliant idea, right? I think, stroke of genius, this. So I need an episode quickly before Christmas on the episode of, on the subject of loneliness. What can I do? So I thought, I know. Imagine if someone was spending Christmas alone and you knew they were spending Christmas alone, and the only way you could reach them was by ringing them, but they're a bit moody, so they're not going to answer the phone. You can just leave an answer phone message for this person. So the concept was, what voicemail would you leave on the phone of somebody that you knew was spending Christmas Day alone? And I was thinking people could, come up with sort of practical advice, places to go, inspirational stories saying, I've been through Christmas on my own and I got through it, and this is how I got through it, or just telling like Christmas themed jokes, just telling funny jokes and stuff, anything to sort of cheer the person up. So I thought, quite a good idea this. So what I'll do is I'll put my Skype details and my WhatsApp number out on social media, and then just ask members of the public to leave video messages on Skype and on WhatsApp, and then I'd compile them all together into a podcast and put them out there for people that are spending Christmas alone. I thought it's quite a good idea, that. I was thinking, I've put it out on social media. That's the sort of thing that might go viral. And so, yeah, I put it out there on Facebook and Twitter, and I thought, just to give it that extra push, I'll pay to promote it. Yeah. So the long and short of it is nothing, rubbish. Nobody retweeted it. Nobody shared it. Nobody was interested. I got one response back from it. I was thinking this is one of those things where people would see it and think, oh my God, that's a really good idea. Like maybe celebrities would get involved, and then it'd turn into like a big thing. And, maybe we could sort of then piggyback like a charity event off the back of it, maybe raise some money for people. Nothing, rubbish. So then I'm left with, well, now what do I do? I was thinking maybe I could just sort of sit in front of a microphone and talk for an hour and maybe relay my story of the Christmas I spent alone. But I don't know. I mean, it wasn't, not that it's, I mean, it is a bit depressing to talk about, and that's not quite what I was going for with the episode. But also, I didn't do anything. That Christmas I spent alone, I just sort of sat in front of Facebook, scrolling through everybody else's lives, seeing what they were doing, and snorted a lot of cocaine. So probably not the best Christmas story, although a little joke about white Christmas is in there somewhere. But anyway, so I thought, okay, I'm going to have to try and find someone to interview. So I sent an email out to my guest today, and luckily she's a rock star. She got back to me. She made time for me, and she's managed to appear on the episode today. Anyway, so sort of last minute are the arrangements for this conversation that my guest Carla is conducting this interview. I think she's on a mobile phone, sitting in, I think it's a canteen in a hotel, first thing in the morning, while she's driving on her way to see her parents for the holidays. So yeah, she's really sort of gone out of her way to do this for us. Okay, so my guest today, and excuse me, I'm gonna have to read this off the screen. I know it looks very unprofessional, but I'm in a rush. I just want to get this thrown out there. My guest today is Carla Perissinotto. She is an associate professor in the Division of Geriatrics and first associate chief for geriatrics clinical program at the University of California, San Francisco. She's the recipient of the HRSA Geriatric Academic Career Award, and in 2012 gained international recognition for her study on the effects of loneliness on the health of older adults. Carla is a contributor to the geriatrics and palliative care blog GeriPal, and every year, as part of her efforts to improve the care of older patients in low-resource settings across the globe, she volunteers her services in South Mexico at the Hospital San Carlos, which serves the indigenous people of Chiapas. So in today's episode, we are talking about loneliness, but specifically in the context of the elderly, which, as well as being Carla's speciality, I thought was particularly sort of apposite for this time of year. And we will do the younger generation and loneliness at some point, but I just think there's probably different factors at play with that one, so it's a completely different conversation. Also, I know talking about loneliness at this time of year sort of seems quite maudlin, and I do promise to do a couple of fun, more upbeat episodes between now and New Year, but it is an important topic, so I did want to cover it. Anyway, I hope you enjoy this episode, despite it being cobbled together at the last minute, particularly this introduction. But as I always say, please enjoy my conversation with Dr. Carla Perissinotto. Right, okay. Carla Perissinotto, welcome to the podcast.
Yes.
Thank you for joining
Thank
me. Okay, let's just say straight off the bat, you are already my favorite guest of all time. Okay, even if this interview goes completely tits up and halfway through it you get annoyed, you storm off, you call me an ugly ginger bearded loser, you'll still be in my top 3. Okay, because
that means we can't fail. That's good.
we can't fail because well, I think I mentioned it already in the last episode. I've had a bunch of people cancel on me through December. I think it's probably just because it's December, but all these last minute cancellations.
Yeah.
And so I still had one episode in the bag, which was covering the topic we're going to cover today, which is loneliness. And then that got cancelled at the last minute. So for anyone coming at this, maybe in the new year or whatever, we're doing this interview on Christmas Eve. And
Exactly.
Yeah, and what's your situation at the moment? You're like on the road, aren't you? On your way to your parents or something?
That's exactly right. I live in San Francisco and I'm heading down south in California, and it's a 6-hour drive. And so my husband and I decided to split it up. And so we got here to this hotel in the middle of California about midnight last night. So hence my morning coffee.
Well, like I
So
say,
yes,
and
I'm in a lobby, but here I am. So
well, it's hugely appreciated. And yeah, you definitely saved my ass this Christmas anyway. So
no problem. Well, I think what partially convinced me is that you were nice, and then two, I do actually think it's an important topic over the holidays. So I thought it was appropriate to actually keep it going and make sure you didn't have cancellations. So I'm glad.
yes, well, thank you. And yeah, it is an important topic, and it's a bit of a tricky one with Christmas. You kind of feel like, should I do something cheerful because it's Christmas? But with this being a mental health podcast, I mean, I'm going to do some cheerful episodes and stuff for New Year and that. But for now, I really wanted to do this one. So, like I say, we're covering the topic of loneliness, but today specifically, it's in the context of the elderly, and
Hmm.
a couple of reasons for that. One is that's your speciality. The other reason, though, is I think that loneliness amongst the elderly and loneliness amongst the younger generation are maybe two different problems with two different solutions. I don't know what you think about that.
Yeah, it's possible, and I'm not actually sure about that. I think that some of the mechanisms by which people enter loneliness may be similar, but certainly as you get older, your risks are going to be higher. I'm hearing a lot of noise. I don't know if you can
Oh,
hear
like
all that. Are you good?
don't worry about that. Like I say,
I know we're live.
as long as we
Yeah,
can hear you,
great.
forget
Don't
everybody
mind.
else.
I'll just
That's
try to
hey,
ignore everyone else.
if any of my listeners are going to have the cheek to complain about the sound quality after all this, they are welcome to never listen again because,
That
like I
sounds
say,
good. I'll
very
just
much
try not to be distracted. That's good.
very much gone out of your way to do this. So
Yeah.
yeah, so I think the two different topics, and I, I mean, I know loneliness amongst the elderly is a problem in general, but
Yeah.
I'm guessing it hits home. It's that little bit worse at Christmas, and I say that speaking from experience. So I've said in a past episode that I spent Christmas 2012 by myself, and
Mhm.
I'm a bit of a hermit anyway, a bit of a social rattlesnake. I'm not really a people person, and so I'm quite happy in my own company. But back in 2012, me and my partner, we split up, and my little boy went with her, and like I say, even though I'm quite happy being by myself, that was a different feeling. That was loneliness that
Yeah.
Christmas, and um, not a good feeling. But um, I think what's important as well is to sort of lay the groundwork here is to actually give a proper definition of what loneliness is, and separating it from things like being a social outcast, being a bit of a
Yeah.
hermit, depression, things like that. So yeah, over to you with that.
Yeah, I have to say, actually, you would think that we had rehearsed this because the way you just described your situation is exactly how you can define loneliness and the difference with being alone. Because many people assume that, oh, he's alone, she's alone, therefore they're lonely. But that's not actually the case. And what you said is that you're perfectly happy being alone. And I think the difference is that when it's your choice, when it's suddenly not your choice, or there's circumstances that make it so you are alone, it's distressing. And so you said you were not doing well with that situation of not being around your little kid, and that's exactly what it is. So the way we define loneliness then in kind of the technical terms is the distress that happens when you are alone. So the distress that happens from you have desired relationships or what you want, and then there's what actually is happening. And so it's a subjective feeling, which means I can't tell you, Danny, whether you feel lonely. I may have assumptions, which could be my issue about assuming things about people, but I can't tell you. It is something that you feel. And that's in comparison to isolation or social isolation, which is actually like the number of relationships. So it could be that I'm married, I have a good social network at work, I have contacts. So I'm not socially isolated because I have a lot of people around me, but I could still feel very lonely. And loneliness is also not something that can happen every day. There may be times that I'm doing great, and other times where that loneliness creeps up. And I think that's exactly right what you're saying. The holidays happen to be a time where these emotions can come up quite a bit more.
Yeah, I did. What I thought was interesting is I've watched a couple of your talks and stuff on YouTube, and it never
Yeah.
even really occurred to me, this idea that people can have a sense of loneliness even when they're married, or they're in a long-term partnership, or they've
Oh my
got friends
goodness.
around them. And I mean, can you sort of expand on that a little bit, and sort of, is there a general explanation for why people maybe feel that way? I mean, they live with somebody, they're married to somebody,
I know.
and you would assume, well, that's surely they can't be lonely. So how does that come about?
Yeah, it's kind of a tricky thing there, because certainly you would think that being married or being partnered is in a sense protective, or it should be. But I think this gets to the quality of relationships, right? And so maybe that it's going to change demographically depending on how we do. And my generation may be different than yours. I don't know if we're from the same generation or not, or other generations. So it's really about the quality of relationships. And so certainly if you were married, you were at lower risk. But I think it's remembering that just because you're married, it doesn't mean you can't experience that. Or similarly, I was actually just giving a talk recently for a spiritual community, a religious congregation, and we had to remind our listeners, or our participants there, that you could be a part of a church community and still feel lonely, and to remember that that shouldn't make us feel bad or guilty. It's just something that happens. It's more of then what we do about it, and can we do anything about it. But why it may happen, it's so hard to say. I think it depends on the relationship and what's going on there and what's missing. Ultimately, when you feel lonely, there's something that's not being met. You are wanting something else. Now, that could be because it's very legitimate. There's something that is missing. It's not a good quality. You feel that the person you're talking to is just talking and not really empathetic. Um, there's a myriad of different reasons. It could also be that that you have a personality trait that does make it a little bit harder for you to form relationships. So there's lots of different things. It could also be that you're married, but the reason you're lonely has nothing to do with your spouse. It's because of something else. And so that's why this topic is so fascinating to me. And very difficult, because I can't just give you this one answer, simple response. This is what you're going to do right now to cure it all. I can give you ideas, but it's very complicated.
Yeah,
And humans are complicated.
that's true. um, yeah, the other thing I suppose is worth kind of defining it from, that's the right term, is
Yeah.
depression as well, because I guess a lot of
Yes.
people would think, well, maybe you're
Yes.
just depressed. And
Yes. One of my biggest
how
pet peeves.
really? So yeah, how do we make a distinction between
Yeah.
those two?
Yeah, absolutely. And I think, again, I think this is an important thing, and it's really important for clinicians. So I'm a physician, to really understand what we're talking about. Depression has a whole series of things that go with it, right? So it's not just feeling down. Loneliness can be part of your feelings of depression, but it's not actually part of the definition of depression, interestingly, for one. And the other thing, that there's a whole slew of things that happen with depression that don't happen with your loneliness, and when you're lonely. So depression, it could be a lack of interest in doing things. It could be changes in sleep. It can be a changes in energy, difficulty concentrating, feeling bad about yourself, and then ultimately, of course, there's suicidality. So those things are all there, so you can be depressed and lonely, because all those things that are going on inside of you can also um, make you less likely to want to be with other people and to have pleasure out of the relationships you have with others. But you can be lonely and have periods of not being depressed. I mean, I know that there's been times when, let's say, I've been traveling for a while and my husband is away, and I might feel lonely, because I'm not with my husband, because I'm missing the quality and the relationship that I get from him. But that doesn't mean that I'm depressed, in that moment. I am still able to sleep. I'm still enjoying other things. You're smiling. I don't know what you're thinking.
What? No, yeah. Well, no. What I'm smiling at is, I'm just thinking that I just remember sitting is in this room at this desk, and it was Christmas Day, and I'm watching everybody else doing their thing on Facebook, and it wasn't depression. I wasn't feeling depressed, even though I was going through a bit of a bad time. You know, we'd been split up
Right.
for a couple of months at that point, and
Yeah.
I was like down in the dumps about it. But that feeling of being alone, that was a
Yeah.
very, very specific feeling that I'd never felt before and have never felt
Yeah.
since. And I just think it's that even though you're talking about this kind of this subjectivity that's there,
Yeah.
I think it is a very definite, very easily identifiable thing
Yep.
in yourself. Like you know when you feel that. And
Yep.
yeah, interestingly, when you were saying about like traveling on the road and stuff, I don't know if this is maybe like a kind of a philosophical thing, but it for me, the idea of, you know, if I was out traveling, I'm on my own, I imagine that I could be hiking up some mountains in the middle of nowhere for a
Mhm.
couple of months and I'd be perfectly fine, just
Right.
so long
Right.
as I knew that there was people to go back to.
Yep.
Do you know
Yep.
what I mean? So not necessarily just the quality of the relationship, but just knowing that there's a relationship that exists out there somewhere
Yeah.
anyway is I
Mhm.
suppose a part of
Mhm.
it as well. Um,
Yeah.
okay, so in a more general sense,
Yeah.
is there any kind of statistics or demographics
Yeah.
you can sort of throw at us off the top of your head that sort of paint a picture of what the well, I guess what the situation is like, I guess, in terms of loneliness amongst the elderly.
Yeah, yeah, absolutely. And I'll tell you a couple things is that, and I'll backtrack a little bit to what you just said now, is that that feeling that you just described, I think is something that it is very innate. It is a very human core emotion. And many of the people writing in this or researching on this would actually say that it is as significant physiologically as hunger and thirst. That when we feel that sense of longing of loneliness, it is something physiologically going on in our body. It is something that's saying, this is a warning. There's something that is missing, and I need to try to do something about it before I really go and have more risk to myself. So there's great things written about this. So I think this is why this topic is actually resonating with a lot of people, Danny. Like I've been surprised in seeing in the news media, actually a lot of people are interested in this, and I think it's because it's very believable. And I would guess that most people have experienced this at some time. Doesn't mean that you're chronically lonely. So that gets to the definition. So in the medical and social community or social science community, we define loneliness as we ask people questions. Do you feel left out? Do you lack companionship? And do you feel isolated? Okay, those are the three questions we ask people. We ask, do you never feel that way, some of the time, or all the time? And how people answer those two questions give you a sense of, like, is this something that's happening every day? So if every day I'm feeling I lack companionship, feeling isolated, um, um, then that's a sign to me that something going on. So in older adults and in the research that I did, we looked at people over age 60 and asked them these questions. And if the people responded that they felt some of the time to any of these loneliness questions, we classified them as lonely. And in the United States, it was about 43% of people over the age of 60 reported loneliness. Now, if you get into the severe, like every day, then the numbers probably drop to somewhere between under 10%. A similar study or a similar look at the demographics in the United Kingdom actually looked at rates which were pretty similar, actually, maybe closer to 30%. But we're looking at least at a quarter of the population who is feeling loneliness at some point. So it's not an insignificant number. And then some, even though again, my specialty is in older adults, as we're talking about, this is something that happens to younger folks. And we actually think that there's actually rising rates of loneliness in younger people and young adults. And there's a researcher here in the US, and her name is escaping me, but she actually looks at um, rates of loneliness and looks at when the iPhone came out. And you
Mm.
look at it and you have a graph that's this, and the iPhone comes out, and suddenly loneliness is skyrocketing. And that's telling you again about what do we do about it? What are people doing that we're not interacting with people? So
I don't know if you know if this was covered in the study that you did, but I'm interested in maybe kind of passing out the demographics a little bit, whether there was any sort of interesting patterns with maybe different ethnic
Yeah.
groups and across
Yeah.
genders as well. I mean, just for an example, I think it's, and again, generalizations, but
Yeah, of course.
I would imagine that so I think women are probably find it easier to be sociable and to go out and find find friends and to reach out to people emotionally. It's guys are
Mhm.
sort of notoriously bad at doing that. So I'm just wondering whether the statistics are sort of weighted more towards the guys
Yeah.
that are struggling with this.
Well, that's a tricky question because it depends on how honest guys are with answering surveys. And so, in the research that I did, actually,
Mm,
women were much higher risk of feeling lonely and being lonely. But there's a lot
right.
of work, which I think is starting to change. And I think why actually things like what you're doing in podcasts and actually talking about mental health openly are so important is because getting the dialogue open and getting people to talk about and saying it's okay. So it may be is it a reporting bias, meaning that who's being more honest about it. So in the research that I did, you were at greater risk of being lonely if you were a woman, if you were older, if you were alone, and if you were non-white. So that included, every other ethnic group. And I think you can sparse it out more from there. And I can tell you from my own experience as a physician that, in my clinics or in my community, if I have an immigrant older adult who is a monolingual, Farsi speaking in a community where there are few Farsi speakers, that is incredibly both socially isolating and can induce feelings of loneliness. And I've had patients that are very lonely, not being a part of their community and not having someone with whom they can make new relationships. So those are kind of some of the interesting you know things that I've observed in my practice. I can also tell you that um, one of my favorite patients of all time, even though I'm not supposed to say that, but but it happens. Um, she was 92, I believe, 92 or 93 when she passed away. Actually, no, I think she was 95. I knew her for a long time. And she had been widowed for about 5 years, and it was the most devastating thing for her. She never wanted to find another partner, versus I've had other patients who end up going on and finding a new partner, but she had this deep sense of loneliness that would just not go away. Would she enjoy things if we went out for coffee or if, when I came to go see her? I mean, my visits to her, I make house calls. I go visit older adults in their homes, and my visits were, I think, more social than anything. But all she wanted was to be with her husband in heaven. And what she described as her loneliness every day, she said, I get up from my bed, I go to the commode, I go to the dining room table, I go back to my bed. That is my day. That is the extent of my day with very little social contact. And that makes me feel very lonely. So,
Mm, yeah. Well, interestingly, in that particular case, um, again, how would you sort of there's maybe three
yeah,
things going on there. How would you make them this loneliness, grief, and depression maybe all tied
yeah,
up, or
yeah.
which is maybe the predominant force there?
Yep, yep. I think that, and this is why it's so complicated. I think very early on, it seemed very clearly grief. But 5 years, 7 years later, you should not have that complicated long grief for that long. And so, how do you distinguish then this? You could still have a longing for a person, but not this grief that leaves you incapacitated. Does it happen? It does. But how do I distinguish it as a clinician? Is actually to go through some of the diagnostic things we do in medicine to figure out, is this really depression or not? And so there were times that she probably had all three, but at the end she actually really was left with not a clinical depression but really loneliness. And that does, absolutely, to your point, you know um, help me think about, how do I target it, right? So if it's grief, some of it really is about talking through and giving time about the loss of a person, and there's different types about that. With depression, it can be medications, it can be exercise, it can be therapy, it can be all those different things. She wasn't interested in medications when she was depressed, and exercise was very challenging for her because she was very limited mobility. But one of the things that we did do is she really enjoyed going out to the theater, to dinner. And so even if we could do that once in a while, that was a great thing. The other thing that I did is that she had these old letters from her husband had been in the military, and she had these old letters of when they first met, before they were married, or when they first got married, that he wrote to her. And there were these, like, this romance doesn't exist anymore. Don't tell my husband, but like, but it was beautiful. But it was beautiful, beautiful. These letters that this man wrote to her, and as she got older and her vision got worse, she couldn't read them. And so that comfort that she had from him, even with him not being there, was gone because she couldn't read them. So I actually I transcribed them onto a tape, so that she could listen to them. And it wasn't his voice, but it was a little extra thing so that she could still find comfort in his words, to know that she wasn't alone. So I didn't study that rigorously. That's just my end of my example of one person where I tried to do a unique kind of thing for her, which I think is really what we're talking about, is that it's not this, for the most part, it's not a one size fits all thing. It's what's missing for this person. I know that was for her. Her husband was missing. I couldn't bring him back. So how could I make her feel closer to him?
Yeah, well, we will get onto that a little bit later. Just sort of maybe, I don't know, throw
Yeah.
around some ideas of little random acts of
Yeah.
kindness and things like
Absolutely.
that.
Yeah.
Before we go forward though, because there's more to it than with this study that you did. There's more to it than just people feel lonely.
Yes.
The consequences are much worse than just sort of feeling bad. But before I ask that one, before I forget, I'm interested in what the inspiration was for this study. What made you decide like loneliness is something I need to do a
Yeah.
study on? What was the inspiration there?
Yeah. So I think, as I said, I'm a geriatrician and palliative medicine physician. So I take care of older adults and older adults with serious illness, or people at the end of their life. And I'm an anthropologist underneath this all. So in the U.S., when you go to medical school, it's a little bit different. When you go to medical school, you've done another degree. So I happen to study anthropology and public health. And because of that, my interest in medicine has always been around everything else in medicine that they don't teach you. So like all the important things, like what happens in the social world of an individual, and what happens in someone's family and someone's community. And they do sort of teach you that, but it's really, I don't think we place as much weight to it as the quote unquote like real hard sciences and biological things. And so when I started meeting patients, or people in my clinic, and saw, well, some of them were getting weaker and losing their independence and going to their nursing homes. And I was saying, okay, I'm looking at their heart disease and their cholesterol and diabetes. I thought that there was something else that must be missing, that we were not measuring, that we really weren't paying attention to as clinicians. And honestly, it was a little bit of a random thing, that I was just reading different studies, and I started finding these questions on loneliness and delving more into the topic. And I was very intrigued. I'm like, this is something very interesting. And I started realizing that this is probably something I was seeing in my patients and not identifying, like not recognizing it as something that as a physician I needed to know more about. And so I started learning and researching. So the study that I did was out of a large national representative sample here in the United States, and it asked these loneliness questions, which is a questionnaire that someone had developed earlier. But it just became very intriguing to me, that I was like, this is what's going on. There's something, in the same way that probably when the medical community started looking at depression, is realizing there are things going on in people's lives that are affecting their health, our health, and we're not paying attention to them. And I want to know what that is. And I ultimately, what was important to me is knowing how much older adults, and frankly everyone, values their independence, is what can I do as a physician to help this person stay independent and stay in their home if that's what they want. And I don't think it's just checking their blood pressure. I think there's something else.
Yeah, well, I mean, I've got to say, it's before sort of reading into this myself, and I'm coming from this from a mental health standpoint, and I'm very familiar with the mind body connection. But just as a concept, it might sound to some people a bit sort of a bit tenuous, maybe even a bit woo woo, that being lonely has sort of physical consequences. But the results of your study, they're not ambiguous results are they?
Yeah,
If
yeah.
you could take us through those results.
Yeah, absolutely. And I will add to what you're saying that when I first looking into this topic, it was very much like ooh, it's a little like wishy-washy. It's not real science. And I was, I'll save my expletives, but I was like, screw you. This is some real stuff going on here. Um, and I did get a lot of that. This is just depression. You don't know what you're measuring, blah, blah, blah. So it has not been the easiest route. But you're absolutely right. My findings were very conclusive, and there's been many since that. So in my study, again, because I was interested in people keeping their independence, what I was interested in looking at people's risk of losing their abilities to be independent, which in geriatrics we use the activities of daily living. So can you get dressed by yourself, go to the bathroom, get up from the chair to the couch, or get up from the chair to the bed? And then we also looked at people's ability to walk and raise things above their head. So those are how we measured someone's function, their ability to live independently, and we looked at death. And in my study, what we found that if you felt lonely compared to people who were not lonely, you had a 69%, no, 59% increased risk of losing your independence just by reporting loneliness over a 6-year period. And you had a 45% increased risk of death, of dying if you reported feeling lonely. And what was significant about this is that when we do research, you're taking all comers and then you look at the results and then you say, okay, is there something else that could be affecting this relationship, that could be somehow that someone's lonely, but there's other things going on in their health that are actually leading to that outcome, to that death or loss of independence. And so what we did is then we took out, okay, well, let's take out depression. Let's take out heart disease. Let's take out smoking and exercise, all the things that we know affect health. So we took all those out of the equation. And what we found that even without all those things, just by being lonely, you could be otherwise quote unquote healthy and lonely, and you had a higher risk of losing your independence and death. And that's why this really, the study findings were really important, is because it was unequivocally a big risk. And we've had multiple studies since then showing more risk factors. So,
Yeah, I think
or
there's
more health consequences, sorry.
yeah, I think there was maybe I think I stumbled across a study that linked loneliness with was it cardiovascular disease or something like that as well?
Oh, yeah. Oh, very real. Cardiovascular disease, Alzheimer's. So you talk about in my experience as a geriatrician, older adults, some of their biggest fears are losing their independence and losing their mind. And I say that in
Mm.
the broad term, in terms of losing their cognition, going into dementia. That is some people's biggest fear. That's probably mine as well.
Me too.
And yeah, exactly. And so just by being lonely, you have an increased risk of dementia. And those studies are actually really interesting because they actually were very in depth and looked at people's brains and actually saw that the protein that you see in the brain with Alzheimer's was in higher concentrations in the brain if you reported feeling lonely. So these are not insignificant things. And one of my friends and colleagues, Julianne Holt Lundstedt, who's a professor in Utah, she's done some beautiful work on meta-analyses looking at all these studies. And she also, what she does is to equate the risk of loneliness to smoking. And she says if you are lonely, the effects on your health are as big as smoking 15 cigarettes a day. That's a
Mm.
lot. That is not a
Yeah,
minor thing.
this all begs the question though.
Yeah.
So we know what loneliness does to your
Yep.
health, but then
Yep.
the next question is why? Like,
Mm-hmm.
what's the
Mm-hmm.
so we've got a correlation, but
Mm-hmm.
what's the causative effect? And I
The
know
causation.
the
Yeah.
causation, yeah. So I know it's a lot of speculation, really. But if you could just run us
Yeah.
through what some of those speculations are.
Yeah, absolutely. And I think you're absolutely right. Causation is incredibly challenging, and it's one of the hardest things to prove in medicine. But some of the theories behind this, and there's some fabulous work, people both in the United Kingdom and the US working on this. But what we think is that, if we get back to this idea that, at our core as humans, we have a fight or flight response. We have, am I safe? Am I not safe feelings, right? And if you're not safe, you have to do something about it. And if you're not safe, that is what causes you to have the fight, you know, the flight response. You run away, you protect yourself, you do all these things because there's something going on. And those emotions, in terms of there's something not right, I'm feeling distress, causes some changes in our body. We think it increases our cortisol, which is our stress hormone, which leads down this other cascade of potentially blood pressure, inflammation. So that's where we think is going on. So that it really turns from this very intense emotion to a physiological change in hormone levels and in inflammation. I don't know that, I can't really get into the nitty gritty of that because it's not my area of expertise, but I think in the broad sense, it's really kind of increased stress response internally that is biochemical, and that affects other organ systems. So that's what we think.
Yeah, again, I mean, this is sort of maybe going down the philosophical route, and it will
Yeah,
probably, it probably has um, a, a, a material basis. But I'm just
yeah,
wondering whether there's anything in this idea of um, it's a bit of a bro sciencey idea, but this idea that people just give up, that they've got
yeah,
nothing to live for, or they feel that they've
yep,
got nothing to live for, and that then there's just some sort of almost like, even if you believe in religion or whatever, but like people's just the soul dies or something like that. And I'm wondering what,
yeah.
again, all speculative, but I'm just wondering what you think about ideas like that.
I think that may be part of it, but I also think that I also think it's because we assume that this is a normal thing, and I don't want to, this is a tricky area because I don't know that I want to make loneliness into a disease, right? But I do want to raise our awareness that this is an important thing that's happening. So what I don't think is okay to say, oh, that's just a little old person, it's fine for them to be lonely, that is a normal part of the lifespan. That is like what should not happen, right?
Right.
And I think that's what I do think, that at the core of this, there's ageism, and there's this sense that like you're old and you don't matter. And so that is going to lead people, I think, to have this like, it doesn't matter, there's nothing worth living for because society is telling me that I don't matter. And so it's all of that together. So that is a little bit philosophical, but it gets to this like, is this going on because we're not placing importance to this? We're saying, screw you, by yourself, you're fine, and it's not affecting you. And similarly in my medical community, I mean, I can have people coming in, and really what is the biggest thing affecting their health is their loneliness, and I'm talking about their blood pressure, and they could probably care less. And then I'm,
Mm.
6 months later, they come back and their blood pressure is still high, and I'm changing their medications. Nothing's changed. And it's probably because I'm asking the wrong questions. And we as a community are asking the wrong questions. So, and we don't care. We don't care. Or we don't know what to do.
Yeah, well,
So,
it's sort of interestingly on this idea of community. So I know that you, as well as living and working in San Francisco, you
yeah,
travel around the globe and
I
volunteer
do.
services in different countries.
Yeah.
I'm wondering what you think of sort of like the West, like Europe and the US, like our attitude towards the older generation,
Hmm.
and whether
Oh,
you've
yeah.
seen on your travels, whether you've seen something palpably different in the way that the old people are treated.
Absolutely, absolutely. And I would say, sadly, though, I think that that's starting to change because of globalization. So I'll tell you, in one of these areas that I work, so I work in the state of Chiapas, which is in southern Mexico. It is one of the poorest states in Mexico, unfortunately, and one of the most indigenously diverse. So you have communities here that speak completely distinct languages, not dialects, languages that have nothing to do with Spanish. Some of them are just not even related. And in these communities, there has been a very strong social network in that you have an extended family, you have people living together. What I have seen over the 8 years that I've been going there is, in the last 2 years, for the first time, I saw an older woman come in malnourished because of neglect. We had never seen that before. And I talked to the other hospital staff, and I said, hey, like, I'm not surprised, sadly, to see this in America, to see older adults be neglected, but to see it in rural Mexico was very shocking to me. And so yes, I think I'm starting to see that because of globalization and the effect of the United States, and you have a lot of migrants leaving Mexico and coming to the U.S. and leaving their older adults. And so it's been a little bit disappointing and sad to see what's going on. So I do think that there are some drastic differences. The other things you can think about, and again, this is a grand generalization, so I won't speak about one culture specifically. But you think about the United States values, and many European values in some sense too, as being very individualistic. Is that you rely on yourself, you get yourself up by your bootstrap, you don't rely on your community in a broad sense. And that's very different in other places. So again, one of my colleagues, Julianne Holt-Lundstedt, who does a ton of research in this area, she's been looking at these areas called the blue zones, which you may or may not heard of, but these are areas around the globe where people are living well above into their hundreds. And the question is like, well, what's going on there? What is it that's making people live, so long? And some of the theories so far and what they're finding is that part of it's diet, part of it's exercise, and the third part is socialization. Is that in these small towns where they don't have the best medical things in the world, but what they're doing is actually socializing and maintaining a community. So it's where our values, how do we value older adults? How do we make sure that our neighbor who's older, our grandparents, our friends, our patients are always still at the table and feel welcomed at any time?
Why do you think it is that we sort of don't give a shit about the older generation? And
We're
again,
scared.
what are we scared of?
Getting old. Because I don't know how it started. I mean, this is very interesting about attitudes, but somehow we think it's unsexy. It's like you look at how we portray getting older is that we only talk about successful aging and, the very good cases. And so there's this assumption that if you're not running marathons at age 80, you're a failure. And we really make it unglamorous. And so we've moved away from like, having you know the wise old man and the wise grandma as the center of society and relegate him to the side. When did that happen? I don't know. It's embarrassing. I probably should go back to my anthropology readings to figure out what's going on there. But it's something about where we really criminalize in some ways being old. And this happens earlier. I mean, think about, so I am how old am I? I'm 39. I do not have children. If I try to get pregnant now, I will be called an elderly prima gravida, an elderly woman having a first child. I mean, just the terminology we use for these things. And I'll find myself being like, oh my God, I'm going to be 40. That's so awful. And like, when really it's like, great. Like, I'm doing really well, actually. Like, why should I be freaked out about my gray hair? So,
I guess. So what? Okay, one other question I'm interested in, and this is be purely anecdotal, is um,
yeah,
how common is it for you to see people being neglected when they've still, because with the older generation, you think that they end up alone and lonely, again, two different things, but
yeah,
alone, lonely, whatever, because they've outlived everybody. People have just they're
yeah,
the final
yeah,
survivor. But I'm wondering how
yeah,
common it is for you as a physician, in you're going seeing patients when they've got plenty of family left, but the family just
yeah.
don't care or communicate with them. And is
Yep.
that common enough to say that it's common?
Yes. Yes. And I think that is a very interesting thing to see who still has people around them, which again gets to this idea also, right? That you can be around people and still feel lonely. So, and also gets to the interventions of what we do. So I've had, and this is where it's also tricky, like, why is that person lonely? One of the patients, and I've talked about her before in my talks, is that she was very wealthy. She had every resource in the world. She had all her family around her, yet she felt incredibly lonely. I also take care of older adults who are really alone, who really have zero family, very limited contact, but they are connected to every social service in the city. They get free meals, they can go to senior centers, they can do all these different things. There's a ton of things that they're getting. They have a case manager, a social worker, but there's still these profound senses of loneliness. So what's going on? Like, why did those people lose their family? I mean, some of it is not by choice, but why is it that you know that we push people to the side? I mean, I think about it so much with my own parents. So as I said, I live in San Francisco. My parents are in their 70s. My dad's 75, my mom's 74. Um, and I hear in their, when they come to see my husband and I, is that they feel that they're a burden to us,
Mm.
and I don't know where that's coming from. Um, and we actually do a lot. We love when they come up to see us and to stay with us, and they've stayed for extended periods of time. But there's something and it's so hard to put a finger on what it actually is. There's something that's making you say, if you are older, you're a burden. And I think part of that has to do with, as you need to start to need more help and rely on your community, that is perceived as a negative thing because we value so much of independence. So how do you balance the, like, yes, it's great to be independent, but it's also okay to ask for help and to say, you know what, I don't see as well anymore, and so I need help writing my checks. Or, you know what, I don't hear as well anymore, so when we, go to a restaurant, we need to pick a table that's quieter in the corner so I can hear. I don't know, it's really disturbing to me, actually. I mean, I probably spend a lot of time thinking about this too, because of exactly what you say, what I see in my own patients, about why this is happening. It's really distressing.
I've got to
Yeah.
ask, what was it? What was it that made you decide to specialize in this, to become a geriatrician?
Yeah. Yeah, I know, right? It's like people think I'm weird, but I think I'm amazing because of it. No, in that, I mean, I say that in just in that I think it's a fabulous field, and when I teach students, I just tell them, like, how can you not like this field? It is incredible. What I got into it is that, we're getting older. The demographics and the makeup of our cities is changing. San Francisco has one of the largest proportions of older adults in California. And I found that when I was in training, that how we were looking at older adults was just not good. I thought, we're treating older adults the same as younger adults. We're thinking they're going to respond to the same medications. We're applying research data to them that doesn't include them in the studies. I mean, many older adults are excluded from these studies. And so I thought, if I'm going to be in medicine, I actually want to learn how to do this well. And I also found that taking care of older adults was like my most enjoyable. I found myself happy, in terms of, there's a lot that I could do for someone's quality of life and independence. There's a lot that I could do in terms of individualizing care. It really fit my model of what medicine should be, which is to be a holistic provider and really think about just not just the medical concerns, but the real things that matter to people. Um, and I also think that, one of the hardest parts in medicine is when people die, but it is also a beautiful thing when you can help someone in that process to ease it in some ways. And they've been some of the hardest moments for me, but some of the most beautiful too. When my patient Dolores, who I was talking about, died, it was incredibly sad for me, but I was actually very happy for her because I knew that she was happier being with her husband, if you believe in that. But
Hmm.
that's what it was. I felt a big loss, but for her, it was the best thing that could have happened to her. And so it's like you're constantly, juxtaposing your own emotions and your patient's emotions and the real things that happen in life. So it's a beautiful field. There's so much we can do. So I think,
Yeah, well,
and not just in medicine, but older adults in all sense of the way.
yeah. I imagine it is particularly sort of rewarding to be that person that, you go out of your way to try and do the things that aren't being done, to kind of go
Yeah.
the extra mile for people. And I understand that it can be rewarding, but I'm interested in what's how does your job make you feel personally about getting older?
Yeah. Um, so that's a very nuanced question, or very, I should say, I have a nuanced answer in that. It depends on who's going into geriatrics, because there's a part of me that's very terrified, because just this week I was so angry, and I tend to be a social activist in many ways, and so I've had 4 patients this week who were doing terribly because of medications they were given. And I was so freaking angry about it. And I'm constantly wanting to write letters to the editor and to someone to listen about how we're treating our older adults. And so there's a part of me, and like, so literally the practical story is that I have a patient who went into a nursing home after a hip fracture, and they're like, she's getting very agitated in the morning and they want to medicate her. And I was like, she doesn't need medication. Like, this is just her behavior from having dementia. She doesn't understand what's going around her. And you guys are forcing her in the morning to take her pills at a certain time. Like, of course she's going to lash out. And so, I was joking with my husband because he knows I'm like not a nice person in the morning. And I'm like, for guaranteed when I'm 90, they're going to try to restrain me at 7 o'clock in the morning. If they try to wake me up and yell at me to take my medicines, like, I will probably hit people. But like, that is my personality. That does not require me needing medications, I don't think. But like, so that scares me about getting older in terms of, is our society prepared for it? Like, that very much scares me. In terms of getting older, there are some things that I really look forward to. I think, you know, just the wisdom of life, experiences, getting to train new generations. So there are some things that are really beautiful that, like, I'm excited that I won't have to do some things anymore. So that's exciting to me. But I do think a lot is dependent on how our society and culture, I mean, it sounds very like la-ti-da, but how we view older adults. So that's the fear in me, but that also is what ignites me to make change and to help us, and I better select my physician now so I'm prepared so I don't get meditated and left in a corner in a nursing home. But
Do you think it takes a certain type of person to sort of face up to the things that we fear about aging? So like you say, the reason we kind of shut the elderly away
yeah,
and people don't want to deal with them is because they themselves fear getting old, they themselves fear dying. And I'm wondering if it takes a certain kind of person, a special kind of person that's interested in that field or that wants to work in that field, then how do the rest of us overcome that fear? Because until people overcome that fear, they're not going to reach out and try and get involved with the older generation.
right,
So
yeah.
yeah,
I
over
mean,
to you.
I Yeah, I mean, I think there are, I mean, certainly it is a kind of, so to speak, a certain type of person that goes into um, but I also think that's true of any profession, of anything. Like, not everyone's going to work in construction. Not everyone's going to want to be a bricklayer. Not everyone's going to want to be a whatever the field. It does take a certain interest, but I also think it's about exposure, right? So we taught at UCSF, where I teach and where I work, at University of California, San Francisco. We, for the first time, taught all of our medical students, 160 of them, I think, first year medical students, and took them out on experiences with us as geriatricians. One, to meet us as geriatricians, and also to meet some of our patients. And they were able to see our patients in their home, in nursing homes, in group homes, whatever it was. And some of the students said, wow, I've never been exposed to this. I would have never considered it. But now that I've seen it, I can see how cool it is. So part of it is exposure, right? So it's just getting past the hurdle of, like, that's the unknown and the scary. And if we don't do that, and if we don't change our dialogue, then no one's going to go into this field. So yes, I think there's some people that are more likely to be geriatricians, but I don't, or be interested in being comfortable with getting older. But it is also about changing our dialogue of how we talk about it. I mean, I have perfectly lovely patients who are in their home, terrible arthritis, who have great quality of life. You wouldn't think so because of the assumptions that we're making, because they're not out walking about, but some people are perfectly happy that way. And so we have to be careful about making assumptions about people. But it's not that, I mean, it can be scary, but even just to sit with someone and say, like, tell me about your life. you know what makes you happy? What were you like when you were younger? And you get these amazing stories, like things you'd never thought you'd heard. And this is, I think, why the anthropology and geriatrics comes together. It's the storytelling, is that people have amazing life stories and amazing wisdom. I'm a huge worrier, huge, unfortunately, and so I can relate to your anxiety. I have a patient, also one of my favorites, who, when I would tell her, I'd say, Anita, I'm worried about this. She's like, Carla, don't waste a good worry. So So it's like, those things still come to me, and I'll share them with my patients. I'm worried about this. I'm like, don't waste a good worry. Don't worry about your, eating that chocolate cake with your diabetes. Like, worry about something else. So, it's a nice reminder in those things. Like, I wouldn't have had that wisdom had I not been close enough to someone in their 90s, as they're reflecting on their life. So many life lessons. She was also with me when my husband and I were getting married, and I remember, I'm like digressing, but this is a good story, that my husband and I were moving in together, and we were like, moving into the same space is hard, and I was like so irritated because he like made me throw away my bottle of like WD-40, my like swear to God. It's like, because we had two and someone had to get rid of one. And of course, I get rid of mine. And then, like, 2 months later, like, the one we kept, which was his, didn't work. I'm like, see, I told you, I should have kept mine. But, that day or the night before, we'd been having this discussion, and I see her the next day, and she says, and she's moving out of her home to a smaller place with her husband. And she said, we have a lifetime of memories and objects. How do I even distill it down to just a few objects, when every one of those objects has a ton of memories? And it was just such a beautiful moment that I thought, take all my WD-40s and all my stupid things, like, let's get rid of it, and we don't need it, and keep those memories. And it was just like, I still remember that to this day. And this was because I was going with her through this final transition of her life, of moving from her home independently to an older adult community, and what that was like for her. And I think I helped her. She gave me something from her home that is up at her house, and it just, you can't get that any other way unless we get over our fear, or partial our fears, or move our fear away aside for a little while to engage with older adults. So
Okay, so let's get a little practical now, sort of coming to the end of
okay,
this.
yeah,
So I'm interested in sort of advice for people feeling lonely, and maybe advice for people to
yeah,
sort of reach out. So, okay, we'll start with what can your average person do to
hmm,
especially now it's like the Christmas period. What can somebody go out and do? And
yep,
as well as the, you see, you see this on the one hand, there's these kind of obvious things where you can maybe go volunteer at places,
yep,
um, which is fine. The one I'm sort of more interested in what your take is, just this idea of just speaking to the neighbor, just speaking to the person near you. Because again, as I was doing a bit of research for this interview, there's a couple of like stories in the newspaper where somebody's, and it wasn't always somebody who was elderly, but somebody's passed away in a flat or an apartment somewhere,
yeah,
and nobody's found them for like 2 weeks, and
yep,
then it's kind of like, how horrendous are these neighbors and these people that live around these people that sort of happened. But I've got to say, so, kind of in the defense of those people, is it seems to me nowadays that it's not the done thing to just go talk to somebody. If you go talk to
right,
the neighbor
yeah.
that you don't know, if you go talk to a stranger, you're mithering, or you're being a weirdo, or you're being a creep or whatever.
Yeah, it's so true.
And I'm just,
Yeah,
what the hell do we do about that? I mean, it's, even if it sort of runs both ways, even if people want to maybe go out and help and talk to people, it's not the done thing. Leave people alone.
yeah. So I think it's so true. And I think that, we're talking about baby steps, right? So I think there's a couple ways to look at this. One, are we trying to ameliorate our own loneliness, or help other people who may be lonely or who may be going on? And I think that there's two ways to look at that. For yourself, is really look within, and if you are feeling lonely, is try to get a sense of, like, why is that? Has that been a lifelong thing? Or is it something new? Did I just change my job? Did I lose my job? Did I, have a change in a partnership? Like, what is missing from me? Like, what used to be there? Like, really deep, take a deep look into yourself, which can be a hard thing to do, to see, like, what do I need to do about this? Or do I want to do anything about it, which is another thing. So that's the first part. In terms of the second part, in terms of when you're thinking externally about other people, it is like, I honestly think we all need to do this, not just for loneliness, but to regain. I'm actually very worried about social connection and where we're heading. And I'm worried about it in terms of our memory and in terms of our ability to engage with other people, because you go to restaurants, you walk down the street, everyone's on their phone, no one's looking around anymore. And like, I honestly, like, it really worries me about what's going on. And so for yourself, I mean, maybe you can't do it for a whole day, but maybe that one walk down the street, you're going to like make a promise to yourself that you're not actually going to bring your phone out, and you're going to look around. You're going to be present and actually see what's around you. I mean, it sounds kind of hokey, but it's like, it's actually like, I do this with myself, which is kind of sad that it's a challenge for me. But how do I do that? I'm like, I'm actually going to like be present in the world today and look around. I'm also going to say hi to that person on the street, and actually you'll be surprised. So if they think you're weird, who cares? We're all a little weird, you know? Like, it doesn't mean that you have to do anything life shattering. And it's the responses I've had from people at times, and I don't, it doesn't mean I'm like this super friendly person every day that says hi to everyone, but once in a while I also get out of my comfort zone. And you can tell when someone's been ignored when suddenly they look up and they're like shocked that someone has actually said anything to them.
Yeah.
And it's just a like, hey, you exist and I see you. um you know I don't know, I think there's actually very little practical steps that way that you really can do. um and with your neighbor, maybe it's too scary to knock on the door the first time, but like, maybe it's leaving a note for the first time. Hey, I'm your neighbor Danny. Just wanted to let you know that, I'm here should you ever need me, or just wanted to say hi. That's all you have to do. You know, my husband's much better at this than I am, actually, in terms of like meeting our neighbors, and I've been really appreciative of it. But it's actually come very handy because it's that, we're looking out for each other so that, if something happens 2 weeks later, someone knows that we've died. It's a rather morbid thought, but it's actually really like being aware of your surroundings, and we're just not doing that anymore. So I would say those are the first two practical steps.
Is there any sort of like organizations, big organizations that you feel are sort of worth getting involved with? Because I don't really know any. I've not really heard of any, to be honest. I mean, there's
Oh
things
my
like, I
God! Well,
mean,
you guys in the UK have huge ones,
well,
like
I know
Silverline.
these. I've never heard of that. See, that's
Ah,
we've got age concern,
yep,
which is one. But I'm thinking specifically, um, not just something to just throw money at. Not just
absolutely.
not just to write your check every month, but I'm thinking of organisations that you get up off your ass and you go and speak to
Yeah,
somebody, that kind of thing.
absolutely. So actually, really, um, the UK has something called the Campaign to End Loneliness, which is a fabulous thing to look into in terms of learning a little bit more about it. And then there's also something called the Silver Line, which is a fabulous program where, and you can look online for that, and you can become a volunteer or just learn. But do it only if it really feels meaningful. I think what we know about volunteer work is that it's not this one time, like, I'm going to make myself feel better because I worked at one place for one day. Not to minimize that, because there is value in that, but to really make change, it's really the relationship part. And actually, interesting, the research on using volunteerism to combat loneliness is only good if you sustain it, if you have a sustaining relationship over time. But the Silver Line actually pairs people with volunteers for friendly visitor call. So it's all telephone based, which is actually a fabulous program. So that's another thing too. But it may just be in your own community is looking. So I think through the campaign through End Loneliness and through the Silver Line, you can be aware of what other resources are available in your own community. Um, but again, I think it's like sometimes it's just starting small, and really it's the neighbor, there may be a nursing home nearby. It may be
What
writing
would you
cards to people.
Yeah, what would you say about what it's a bit of a paradox this, because social media, things like Facebook, gets
Yeah,
accused of um hey up, gets accused of sort of separating people, and like you were
yeah,
saying, there's not as much sort of real connection there. But
yeah.
if you've got an elderly person who's feeling isolated, would you recommend they sign up to social media and, I don't know, try and make connections that way?
Yeah, I think that's where we get into this, like, what's going to be important for that person, because for some people that's going to be a great way to connect, where it may open a world where they never had it before. For other people it
Right.
may be too isolating, but it's worth giving a try. And so I think for some people it really is great. I have the husband of an old patient of mine who moved to China, and often I think feels pretty lonely out there, and he's told me. And so I wish we connected more than we did, but I think even just our connection here and there over email is at least one little way to remember that there's still social connections. There's still someone that cares about you, even if you're far away, which is true. I mean, I really feel that way about him. And so for some people, that's been really great. I know that even for the relationship with my parents, in terms of feeling like a connected family, you know, texting is sometimes a great thing. I don't think it can replace a true in-person connection. And sometimes, Mom, I apologize if you're going to listen to this, but sometimes it's a little bit hard if my mom texts me these long things in the middle of the day when I'm working. But like overall, that is a really nice way to still say like, hey, I'm thinking about you today. And, you know, it's just a little something. And so that's going to vary from person to person. My dad doesn't text anymore because his vision is terrible. And so for him, I think it's much more about the in-person connection. And so it's having to individualize and see. So I think it's, you know, Danny, what you're saying is actually like asking questions and having conversations about like what's going to work. And it's scary, but like that's what this is about. And so, you know, it's just, yeah, I don't know. There's a lot we can do. There's a lot we can do. And I like what you're thinking, is thinking in the practical, simple, but also thinking bigger in terms of what are the bigger things that I can do.
Yeah, well, what I
I mean,
will do
we've
is
thought about in our practice sending cards to some of our patients in our practice that maybe don't get cards on their birthdays or on the holidays. You know?
Yeah, what we'll do is I'll try and dig up some of the like the charities you've mentioned. I'll put
Yeah.
links to those in the show notes, and I'll try and dig up some more as well.
Yeah.
For maybe like the Australia and Canada as well. Okay, Carla, before I let you go, have you got 5 minutes for me to run my quick fire questions past you? Everyone gets subjected
Yeah.
to these. It's kind of you kind of have to go through it, I'm afraid. So,
All right, we'll see. Sounds good.
firstly, have you got any book recommendations, either on this topic or just anything else you feel would be of value to the listeners?
Yeah, actually, the book that I just read, it's actually called Loneliness by John Cacioppo, Caccioppo. He's one of the big researchers in this area. I actually thought the book was going to be hard to follow, and there's parts that are dense, but it's actually really approachable. And I was very just really impressed with how well it's written, really talking about you know the basic needs of humans to belong. So I think that book's been wonderful. Um, oh, I'll start there. But I'll say my other favorite author is someone named Paul Auster, Austr. And the reason I think I'm relating to him is that he has an ability to describe characters and their innate emotions, some of them who've really experienced loneliness. And so I find his books very intriguing. So that's a 2 for 1.
Okay, cool. Again, I will include those in the show notes. Okay.
Great.
If you could take the reins of power at the Department of Health,
Yeah.
what policy
Mm-hmm.
would you implement to improve the mental well-being of the general public or of the
Oh
elderly,
man.
or
Well,
whatever you want to do? I always say to people, just think very dictatorial but benevolent dictator.
yeah, exactly. So very simple. So it's a little bit different in the U.S. than in other parts, but actually to have mental health parity, which means that mental health services are actually covered in the same way as medical services, meaning that there's no limit to who I can see and how often I can see, is a very simple thing. One, that would be my first area of policy. The second area of policy is that to actually invest in resources for loneliness. So for example, we have something called in-home support services, which is for people who are low income, where the city and county will pay for someone to come help you at home. Oops, my mom was just calling through, sorry. Who will come help you at home to help you with your groceries or help you with your laundry or whatever it is. But with this, I would actually have them get paid to be a companion. So.
Okay. What, if anything, keeps you up at night?
Oh my
What's the
God.
big worry?
That's a hard one, but probably that I'm not doing enough for some of my patients, that I'm not solving enough of their problems, but mainly around the social sphere, not really the medical things, that I could be doing more. So
Okay. Well, it's not. I suppose it's just nice to know you've got a doctor that actually worries. I think it's
stays up at night.
well, I think it's an accusation that gets thrown a lot at doctors is, you know, they're just sort
Yeah,
of kind of giving you prescriptions for the pharmaceutical industry and all that. And well, it's no,
yeah,
there's doctors that actually care out there. So,
yeah,
um,
yeah. And our politics in
what's
the United States, that's probably the bigger one right now. Sorry. I'm trying to
yeah,
ignore
that's
that one. I think that's why I didn't mention that one.
yeah. Donald Trump has made quite a few appearances on this podcast during this questionnaire.
Yes,
Um,
yes, yes.
what's the best piece of life advice anyone's ever given you?
Oh man, yeah, actually from my father, which is when I was going through my own serious depression when I was in medical school and contemplating dropping out. It was don't make a big decision when you're not feeling well.
Yeah, good one. Good one. What was you depressed about? What was getting to you?
Who knows? Who knows? That's where I think there's a lot of, it depends on what your views on our depression, but I think that there's a lot of validity and a lot of truth to whether there's really some true chemical imbalances and who knows what triggered it. But not sure, not sure. But it was a rough period, and somehow I stayed in medical school. I took my dad's advice, and here I
Yeah,
am.
and got through it. Yeah, that's the most important thing.
Yeah,
Okay, final
I know,
three.
I know.
What
Yes.
mistakes do you continue to make despite knowing better?
Reading my text message at the stoplight.
That's terrible.
I know. Ugh. Yeah. Okay. Yeah.
You've snitched yourself right in there. Okay.
I know. I'm too honest.
Um,
I'm not a good liar. That's the mistake I keep making. So,
okay. Outside of family and
yeah.
academia, what investment of
Yeah.
time or money has brought you the most joy or fulfillment?
Traveling. Um, Traveling and actually yoga, I would say. But yoga, it's specific type of yoga that actually, because it's the times that it makes me actually sit and be quiet and try not to think, which is exceedingly hard for me. But it is some of the times that have brought me the most peace.
Yes, I've taken up yoga and it's I've done weights before and running, but yoga gets you out of your head and into your body in a good way, in a way that no other sort of physical activity has ever done. It's yeah, I think it's
And
the one
that's
that I
what got
might
me through
finally
medical
stick to.
school.
Yeah.
Yep. Yep. Yep.
Okay, the final one, the big one. What do you
Uh-oh.
think is the key to happiness?
Connection.
That was kind of obvious, that wasn't it? I could
Yeah.
have left that one out.
Yeah.
We've hammered that point home the entire interview.
That's good.
Okay,
Yeah.
Carla, have you got any links you'd like to send the listeners, the viewers to? Any social media, anything, just anything you want to plug away?
I think that honestly, the campaign to end loneliness is a fantastic resource. So I think that's the main one right now. Yeah.
Well, I am going to throw it out there that I do think, just my little 2 cents here. So I know you're sort of a little averse to social media, and I saw in one of your talks that you said you're not actually on Facebook.
I
But
know. It's true.
having having watched a
It's a
couple of your
scary world out
talks,
there.
well, having watched a couple of your talks and spoken to you now, I
Yeah.
think even if you're not going to use it for social purposes, I think you should consider it for just getting the message out there, because I think you're really good at it. I think you're a very
Yeah.
engaging person to watch, and
Thank you.
so I think you should consider maybe a Facebook page and as a way of just getting the message out there a little more. Just my little two
All
cents.
right.
But
I'll put you on the list of people that have told me to do to. Actually, this is a new one. So this is a different take on it. So that's a good one when it's not really about my life, but maybe something else. It's interesting. I just, yeah, that's a whole nother topic, but I have had such better connections with people by not being on Facebook. It's amazing. Like friends that I've not connected with, where they actually have to pick up the damn phone and call me. It's
Yeah.
like nothing else, and I like that. So, but I will consider your recommendation.
Yeah, well, that's it. Yeah, like I say, maybe not to be social, and maybe make sure that people, you
Yeah,
can have a blank profile. Make sure people still have to
yeah,
ring you; they can't message you. But just a
yeah.
Facebook page, just to club people over the head and get people a bit more involved
Okay,
in communicating with the older generation. I think so.
okay, all
Well,
right.
there we go.
I
Carla
like it.
Perissinotto, thank you very much.
Yes,
It's very much appreciated.
absolutely.
I
No
hope you
problem.
have an amazing Christmas. You are still
Thank you.
my favorite guest of all time for doing this for me. And if
Sounds
you ever
good.
want to come back on the podcast to talk about anything, you are more than welcome. So thank you for joining me.
Sounds good. Absolutely. Thank you.